Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about obstructive sleep apnea. Let's start. So today is a very important and a very close to my heart episode, which is centered around obstructive sleep apnea, which in very local language is known as snoring. So why this is very important is because obstructive sleep apnea is one of the biggest silent killers in the world. I don't know about the statistics, but I have noticed this, that most of the diseases, especially lifestyle diseases and metabolic diseases, are very carefully and strongly associated with obstructive sleep apnea. Now, as the word suggests, obstructive sleep apnea. Apnea means the absence of breathing, right? An apneic episode is basically when the breathing stops for briefly 10 seconds. Now, what happens is very simply that when you go back to sleep, especially when you're lying on your back, there's a high likely chance that you might be obese and you might have a bigger tongue and a smaller mouth, and your palate might be narrow, right? So what happens is that when you're breathing while you're sleeping, you're not doing very conscious breathing, right? You're unconscious in that way. So your muscles that are consciously being worked for breathing are not working actively, and thereby you're breathing through your nose. You can also have a deviated nasal septum that can compromise the amount of air that's going inside your nose. So what happens is that because of the passivity of your body lying supine, the tongue tends to fall back and the palate tends to droop and the airway becomes reduced in its lumen. Now, because of this, usually when the air, obviously it's very simple physics, when the air passes through a smaller aperture, it tends to vibrate the palate and the tongue, that produces the classic snoring sound, right? Now, to be very honest, this is something very dangerous, as to it is associated with a lot of diseases such as cardiovascular disease, ischemic heart disease, metabolic syndrome, even stroke and death. So please try to understand the gravity of the situation, that obstructive sleep apnea or snoring, depending upon the degree, this degree of severity, is actually very serious. Now, you have apnea, that means the breathing stops for 10 seconds. What happens when the apnea happens? It's very simple. You have an apneustic center in the medulla oblongata behind your brain, and basically that's your breathing center. The moment your body desaturates, your oxygen saturation will drop because of the lack of oxygen available to exchange, right? Because of the airway being not so patent. So what will happen is this saturation will drop and your breathing will cease for that time because of the complete obstruction, and it will send a signal to your medulla oblongata and the apneustic center. Thereby it will wake you up. So even if you don't remember waking up, you are kind of getting very disturbed sleep. Now basically you have apnea and then you have hypopnea. That means the breathing reduces by 30 to 50% at that point of time, which causes again the disturbed sleep. The amount of times or the events, the number of events per hour where your breath is gone or reduced, or basically you wake up, is basically your apnea hypopnea index, known as AHI. Now a mild obstructive sleep apnea has the range from 5 to 15 per hour. 15 to 29 is moderate, and severe is more than 30. You will experience such bad symptoms, such lifestyle changing symptoms, that you will wake up with a morning headache, you will be all lethargic all day. The very categorically pathognomonic sign that I've seen in patients, because my father suffered from that, my whole family suffers from this, is that you end up talking while you're sitting on a chair and you end up going off to sleep. So that if someone is showing that, apart from the fact that they've actively not slept in the night, but they said that my sleep quality is compromised, there's a high likely chance that they might be having obstructive sleep apnea. And you can ask their spouses or their children if they can hear snoring sounds while they're sleeping, because snoring is apparently glorified in the Indian households for whatever reasons, that he snores and they're such loud snores. It's something to be very terrified about, medically speaking. Now, what you'll end up having is that you'll have a lot of oral symptoms and signs as well. Oral signs that you will have is basically you will have an enlarged uvula, an enlarged tongue, smaller jaw and smaller palate, right? There would be redness, erythema, dry mouth, maybe more cavities, maybe more periodontal problems that might be seen. the biggest symptom that we get is basically drooling of the mouth while they're sleeping, and the symptom is xerostomia. You get a lot of dry mouth, so that causes a lot of problems. Now, what is the treatment for it? There are many treatment modalities for it, to be very honest, depending upon the range and depending upon the symptoms, mild to moderate to severe. For mild, OSA, you basically can undergo behavioral, modifications. If you're obese, you can go for, weight reduction. I know it's not that easy, but you can go. You should avoid consuming beverages like caffeine and alcohol 3 hours before sleep. On top of that, you should try to avoid sleeping supine. One way is to put a tennis ball in the back of the knee side of your pajamas, so that you don't fall asleep. You end up falling asleep on the lateral side. Coming to where the dentists come in as a role is, depending upon the mild to moderate severity of OSA, you have something known as oral appliance therapy. That's also there. Now, mind you, if you're a dentist watching this, you have to be trained in dental sleep medicine, and you have to have a very good repertoire with the sleep technician or the sleep doctor or the sleep medicine specialist, so that you can work together in tandem to make sure that whatever appliance you're giving, which could be a mandibular repositioning device, a mandibular advancing device. So these devices basically pull the mandible, the lower jaw forward, thereby housing the tongue in the casing and making sure that when the patient sleeps, the airway is patent. On top of that, for moderate to severe OSAs, you have the CPAP, the continuous positive airway pressure, or BiPAP as well, which basically makes sure that there is a gust of air through the room and the humidifier from the machine that makes sure that through the mask that the airway is kept patent. That's very important. However, in most of the cases, 20% of the people are able to adhere to it because it's very uncomfortable. It's comfortable at the start, but compliance is a big issue. They have still not come up with something that would help aid in making the patients comfortable when it comes to CPAP and BiPAP. That's very important. And you have, as I've told, you have surgical techniques as well. You have uvulopalatopharyngoplasty, laser uvuloplasty, assisted uvuloplasty, so many things that are there. For very severe cases, sometimes you might have to go for, surgical treatment of the facial skeleton, where you can go for a bilateral sagittal split osteotomy. At the same time, you can go for the Lafort osteotomy and mandibular advancement. That is basically the purview of, once we diagnose what's the severity of the OSA and what all things are kind of causing the problems. So it's very important as a dentist, as a patient, as a human, to understand that if anyone in your house is actually having a lot of problems when it comes to snoring, they are in a lot of pain even if they don't feel it. Let me be very honest, you're drowsy all day, you're lethargic all day, you're irritable all day, your BP will be higher than normal. That's very important. You are more at risk of cardiovascular incidences. If you are obese, then obviously you might it's been found that you get shortness of breath very faster due to the exacerbation of stress, especially in a dental setting. So if you are a dentist watching this episode, please make sure that you take an adequate history and do a proper examination, and you just ask them after building a trust with your patient, that if they are having any problems with snoring, and if you do find something like that out, please make sure you send them as a referral for polysomnography study, that is a sleep study which is done overnight, to get them the grading of this obstructive sleep apnea, and thereby after that you can refer them to a sleep medicine specialist, and thereby work in tandem together to enhance the quality of life, and they will feel much fresh after the treatment has been done. And whatever things that you need to be careful about, especially around medical history, whatever contraindications, whatever precautions you need to take as a dentist, you need to be very well aware of those things. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles and my WhatsApp number, and please make sure you don't call me directly. Refrain from calling, as I might be busy with patients. Just drop me a message, and within a day or two I can reply back to your messages. If you have any queries, doubts, apprehensions, questions, or suggestions, please feel free to put that in the YouTube comment section. So that's it for today. Thank you.